Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Creutzfeldt-Jakob disease, also called CJD. The Creutzfeldt-Jakob disease is a rare, progressive, fatal, dementing disease caused by an infectious protein called prion. This protein is present in our body, but when it is infectious, then it will cause Creutzfeldt-Jakob disease. Prions are abnormal forms of a cellular protein that cause rapidly progressive neurodegenerative disorder that may be sporadic, familial, or transmitted. Incidence is 1 per 1 million population per year, mostly sporadic. 5 to 10% of cases are familial. Iatrogenic Creutzfeldt-Jakob disease like corneal transplant, dura mater, allograft, injection of pituitary extract. Suppose some people like to get the growth hormone. So from the pituitary extract, they are getting that, and that may transmit the prion to another person and may lead to Creutzfeldt-Jakob disease. Okay. Also, this disease is common in certain occupation like that of a neuroscientist who deal with the brain, or anatomist or neuroanatomist, or a coroner, or the autopsy technicians. Okay, so they have more chance to get Creutzfeldt-Jakob disease. Mad cow disease, a variant of Creutzfeldt-Jakob disease, transmissible from infected cow to human through beef. Idea is that the cow got the infection because they got the food. That food contained the sheep brain. Okay, so that cow, those cow became infected. That transmits the prion to the human due to consumption of beef. Okay, so this may happen. Kuru, another variant, it was found in cannibalistic people of Highland Papua Guinea. Idea is that this group of people used to they used to eat the dead bodies, and it is found in the Highland Papua Guinea. It is not practiced nowadays, but it was a cause of Creutzfeldt-Jakob disease like feature called Kuru, almost same pathology. Okay, but usually it affects the children and the women because women deal with the viscera in those that society, especially brain. Okay, so we have also some other variant of Creutzfeldt-Jakob disease. So what are the physical findings and clinical presentation? This is a rapidly progressive, untreatable dementia. People will lose memory, people will lose the judgment capacity. May have corticospinal, corticobulbar, like the upper motor neuron, extrapyramidal, that include the basal ganglia, cerebellar and lower motor neuron lesions. Cognitive deficits and behavioral changes. Less commonly, visual, vestibular, sensory and autonomic dysfunctions. Okay, so what is the pathology? Pathology, actually, we will go through exclusion, we'll find out other curable causes of dementia, other causes of dementia like Alzheimer's disease, okay, or some type of vitamin deficiency or multi-infarct dementia, or dementia due to some type of pseudo-dementia due to depression. We have to exclude those all, okay, like that of thyroid dysfunction. We must also exclude that. In case of hypothyroidism, there may be dementia. It may be related to hypothyroidism. Okay, that is curable, no doubt. Okay, about that. Here this is absolutely non-curable dementia and very quickly fatal, going to be fatal. Its incubation period is also variable from 1 year to 30 years. But once the disease established, then it's a matter of months, not even years. People will die due to Creutzfeldt-Jakob disease. So if we go to the pathology, that is only done after the death of the patient. At the autopsy, we can collect the brain and we can assess histopathologically what is going on there. Suppose this is the spongiform encephalopathy. We are getting a lot of vacuoles here, a lot of vacuoles. These vacuoles are present in the cell body of the neuron, the perikaryon, also in the axons and dendrites, also in the synapses. Even we'll get the vacuoles in the neuroglial cells also. So this is here. Histologic features of Creutzfeldt-Jakob disease include spongiform changes. These are the vacuoles. Okay, so they make the spongiform changes. These are the vacuoles. Okay, and in the cerebral cortex, but it involve the entire central nervous system, including the cerebellum, basal ganglia, spinal cord. Okay, here in the inset high magnification of a neuron with vacuoles. Here, this is the vacuole, the high magnification of the neuron. Here, a variant of Creutzfeldt-Jakob disease is characterized by amyloid plaque. We'll get amyloid plaque here. Okay, amyloid plaque, and this amyloid plaque is surrounded by greater spongiform changes around that. So this is the plaque. We call amyloid plaque, also called the mad cow plaque here, or even you may call it Kuru plaque in case of Kuru. Okay, so this is the plaque. That is the amyloid plaque surrounded by the spongiform area of the brain. Okay, so what is the pathology? Again, spongiform changes, vacuolization of the perikaryon, the cell body of the neuron, neuronal cell processes, axons, dendrite, neuroglia, and in synapses. Loss of neuron without inflammation. Is there any treatment for Creutzfeldt-Jakob disease? No, there is no treatment. What is the prognosis? Prognosis is very grim. Disease is uniformly fatal. An average survival is only 7 months after the onset of symptoms. A few patients have lived for several years, and those long surviving cases show extensive atrophy of the gray matter of the brain. Atrophy means decrease in the size, decrease in the size and decrease in the cell number. That is the atrophy. And that's all about the Creutzfeldt-Jakob or Creutzfeldt-Jakob disease. So if you have any question, please feel free to ask me. Please support my channel. Please subscribe me. And have a nice day. Bye now.